is very important to cataract surgery. Today I would like to focus on the phaco emulsification. As we know, the central vision system contains three main features. The first feature is free disc. The new free disc measurement system FMS provides rotary valves, dual segment technology, dual pressure sensors, and new aspiration tubing. Compared to the traditional gravity-free discs with poor compensation, active free disc provides dynamically detect and adjust irrigation pressure to compensate IOP loss. These features result in reducing occlusion break surge, including time and volume displacement. So, by the centurion system, we can use high vacuum setting, providing high holding force to reduce clogging and remove material with minimal ultrasound without increasing risk for conclusion break surge. Besides, we can use low aspiration flow rate to reduce occlusion break surge and reduce endothelium damage, but still maintains good attractability and followability. We can also use low IOP setting to decrease damage to the retina and optic nerve, but still maintain good anterior chamber depth. The next feature is balanced image. The new balance tip is designed to enhance cutting efficiency to increase emulsification effect, reduce the chance of momentary tip occlusion, and diminish the thermal effect. The centurion system is not only designed to maintain surgeon's selected target IOP, but also provide the surgeon to adjust the parameters to customize the surgical procedures. So by I consider it is safety for most of the surgeons to surgery in low IOP status around 50 mm of mercury under medium vacuum setting around 400 mm of mercury. When the surgeon is skilled, I consider 40 mm mercury IOP and 24 milliliter per minute aspiration rate can provide a very stable anterior chamber in high vacuum status up to 700 mm of mercury, and this is my favorite setting. Next, I will going to show some videos. In the infinity system, sometimes we can see occlusion break surge. Now, but in the centurion system, the anterior chamber remains stable in the same step. No surge was noted. In the infinity system, sometimes an obvious surge in occlusion break. However, in the centurion system, the anterior chamber remains very stable under high vacuum status, even in occlusion break. In the centurion system, despite the vacuum is approaching to 700 mm of mercury, we can see the anterior chamber remains very stable. Let's move on to see some challenging cases I have performed by using the centurion system. This is a 65 years old male patient with grade 5 white nuclear sclerosis. Pre-OP BCVA was only hand movement. I consider CCC is another key point to the challenging cases. The Alcon Gaxo microscope offers a very good surgical visualization, so I can perform this white cataract case very good capsule raises without staining the anterior capsule. Then I always use chop technique very carefully to make sure the nucleus is completely divided into 4 quadrants. Then I perform phaco emulsification under high vacuum, low IOP, low aspiration rate, and low phaco energy to prevent the endothelium damage. We can see the anterior chamber remains very stable under high vacuum status throughout the procedures, even in occlusion break. We can see the CDE is around 8. I think it's pretty good to a grade 5 nucleus sclerosis case. The post-OP first day BCVA was 0.7, and we can see a well-centered and broad CCC here. This is a 58 years old female glaucoma patient with small pupil for several years. With my surgical experience, I didn't use any assistive devices in this case. I must emphasize, we should skill at performing capsule raises in regular cases before moving on to perform in the small pupil cases. I always use chop technique to chop the nucleus, avoiding the iris and capsule very carefully. Then perform phaco emulsification. The following key point in such small pupil cases is after engaging the quadrant by high vacuum, the phaco tip should be held in the center to phaco the nucleus for the safety. I always use high vacuum before using phaco power to keep low CDE as I can. We can see the anterior chamber remains stable under high vacuum status even in such small pupil and shallow anterior chamber death cases. Peel of the cortex, also avoiding the iris and capsule very carefully. After inserting the IOL, I complete the small pupil case safely and smoothly with very low CDE. The most of all, I didn't use any assistive devices. By using the Centurion system, I can perform and complete most of the small pupil cataract surgery without using any assistive devices. This 52 years old male patient suffered from cornea penetrating injury about 20 years ago. Because of the pupil decentration, I used an IOL rotator to pull out the dialysis iris and perform a 5 mm capsule raises under Varion guiding very carefully. I also use chop technique to chop the nucleus, avoiding the iris and capsule. Then perform phaco emulsification under high vacuum, low IOP, and low aspiration rate, just as usual. We should pay attention not to touch the iris when phaco the nucleus to prevent further damage. Also, pay attention not to touch the iris and pull the capsule, especially at iridodialysis area when peel of the cortex. The Centurion system provides a very stable anterior chamber during the surgery, and this is very important to the safety of these traumatic cases. After inserting the IOL, we can see the CDE is 0. We can see the CCC margin from the hole here was pretty matched to the 5 mm very long CCC marker. That means the IOL was centered and enclosed in the capsular bag. This patient achieved an amazing result at the first day post-operation. The UCVA was 0.9. This 65 years old male patient from the country of the South Taiwan has suffered from blurred vision for several years. But he had been rejected for the cataract surgery by many doctors. Before he came to my clinic, some doctors told him that his eye was hopeless, while the other doctor told him that his cataract was still incipient, so it was not worthy to receive the surgery. Before the surgery, the vision was only light perception. With my surgical skill and the centurion system providing not only stable active fluidics, but also powerful balanced energy, I complete this case smoothly and safely with low CDE. The patient was very happy after surgery. The UCVA at the first day post-operation was 0.5. This is a 75 years old male patient underwent postpartum vitrectomy for retinal detachment with grade 5 nuclear sclerosis. The actual length was longer than 33 mm. Pre-OP BCVA was only counting finger. Such post-vitrectomy cases usually combined with some challenging conditions, such as large fluctuation in anterior chamber, lack of visual support, occurred zonular instability, and so on. So we must perform every step very carefully. However, as long as we keep the phaco tip in the center to immerse by the nucleus, avoiding catching the capsule, we can see the anterior chamber remains very stable under high vacuum status throughout the procedures, even in occlusion break. Because of the very deep anterior chamber depth and lack of visual support post-vitrectomy, I adjust the IOP setting to 30 mm of mercury when I perform and complete this case smoothly and safely. This is a 52 years old male retinal pigmentosa case with anterior and posterior polar opacity and zonular weakness. Pre-OP BCVA was only hand movement. At this moment, we can see zonular weakness here. In such case, hydrodissection should be performed very carefully and completely to decrease the pressure on the remaining zonule. In such zonular weakness case, no matter we use chop technique or divide quadrant technique, be careful not to press the nucleus and stretch the capsule as possible, especially at the zonular weakness area. And we can see the anterior chamber also remains very stable. Peel of the cortex also avoiding catching the capsule, especially at the zonular weakness area. After inserting the IOL, I also complete these complicated cases smoothly and safely. The BCVA at the first day post-operation was 0.4. In the past 1 year, I have performed several lab surgeries by using the centurion system combined with lenses, Varion, and Luxor microscope. All the surgeries were very smoothly with minimal CDE 0.29, 0.08, and 0. The patients are happy, the doctors are happy, and the outcomes are of course happy. Thank you for your attention.